So for those of us that, it seems like they're saying that high blood sugar affects diabetes, which maybe affects kidney disease, which maybe affects dementia. It seems like blood sugar is a real issue. Maybe I didn't say that right, but it seems like having a high blood sugar is something we're all trying to avoid. So how do you make sure that you keep your blood sugar low? I guess below 100 is considered, or above 100 is considered pre-diabetic. So what do we want our blood sugar at, and how do we keep blood sugar low? We had Cyrus Kambata, who wrote Mastering Diabetes, and he was saying make sure you don't add fat to your diet, but that a little bit conflicts with the people saying you need nuts and seeds and avocados and olives to get enough EPA, DHA. So can you help me to understand what are we trying to do to keep our blood sugar low and also making sure we get enough of the right type of fat for our brains?
So we treat a lot of diabetic patients who have hyperglycemia. And the way we treat them is with a whole plant food diet, regular exercise, and abundant sleep. And what you find in working with real patients is if you put them on a whole plant food diet, give them exercise and sleep, their blood sugars progressively begin to improve, as does their excess weight and many of the other inflammatory markers, et cetera. Sometimes we'll even speed that up faster by putting them on a fasting protocol. Even the American Diabetes Association and some of the conventional people working with diabetics recognize that the most productive and effective way of managing diabetics is with a whole food, complex carbohydrate, low fat, low protein, or relatively low fat, low protein diet. So I don't think that's even that controversial, even in conventional circles nowadays.
Okay.
Well said. To put it in clinical context, we again are carbohydrate burning organisms. You eat an apple and sugar levels go up in the blood. You've got to move that sugar from the bloodstream into the muscle and liver cells, and insulin is secreted. And when insulin docks onto the insulin receptors on the surface of the muscle liver cell, that activates a series of enzymes that pulls glucose into the cell. That's how it's supposed to work. The problem is a high-fat diet, as one keeps their blood fatty day after day with everything from the oils to the meats to the butter fat, the dairy, etc. All this fat starts oozing into the muscle cells and the liver cells, and they inhibit the enzymes that allow insulin to work. So you eat the sugar, insulin comes to dock at the insulin receptor site on the surface of the muscle cell, but nobody answers inside. The enzymes are all gummed up from the fat. And so the blood sugar piles up. They say, oh, high blood sugar, that's the problem. But the high blood sugar, that's the tail of the dog. The problem is the fat in the diet that's inhibiting insulin from doing its job. So that's why we're advocating a whole food plant-based diet, which is naturally low in fats. That will help clear out those insulin receptors, because the fat-induced inhibition of the insulin receptors is reversible. You stop eating all that fat, get on a healthy, high carbohydrate, high fiber diet. You burn that fat in the muscle cell for energy. The insulin receptors open up, and lo and behold, you can handle sugars now. The insulin resistant resolves itself. So it's a fat-induced phenomenon, a reversible fat-induced phenomenon. But pay attention, you don't want to walk around with high sugars day after day after day. The high sugar eventually causes problems with membranes, etc. But again, clear out that fat, let insulin do its thing. Sugar is supposed to go up and down after you eat a high carbohydrate meal. That's what insulin's for. But it's a good reason not to graze and just keep eating all day, because it keeps your insulin levels up all day, and that keeps moving fat into the cells. So eat your healthy meal, let your blood sugar go down, get into a little fasting, a few hours there before you eat your next meal. But the idea is, the problem isn't the sugar. You shouldn't, not in its whole plant forms. Excuse me, you don't want to be refined sugars, but the sugars in a sweet potato or in a grape should not cause any threat to your health.
This is a classic situation where people look at short-term response to, say, dietary change. If you put on people on some greasy, fatty diet, of course, their blood sugar levels will drop because there's no carbohydrate. But that doesn't mean that you're solving the long-term problem. What's good for short-term manipulation of numbers has nothing to do with getting people healthy. And that's exactly the problem, is if you continue to do that short-term gain problem, you end up with a long-term nightmare.
And I'd just add a little bit. I think that we're looking at, when you talk about a healthy blood sugar, we generally say a fasting glucose of under 100 milligrams per deciliter, but I think optimal is probably closer to the range of 70, 72 to about 85 milligrams per deciliter. And the best way, I think it's really important to recognize that there are, a lot of populations in the world that don't have very high rates of type 2 diabetes, and some of them eat a fair bit of fat, and some of them don't. When you look at the blue zone, some are fairly high in fat, some aren't, and yet they have very low rates. To me, the key is not overeating. When you overeat food and you eat too many calories, you store excess calories. Even if it's excess refined sugars, you turn them into fat and you store them as triglycerides. And when you store too much, and especially in the form of visceral fat, and it ends up, you end up with non-alcoholic fatty liver disease. You store it in your liver, you store it in your pancreas, you store it in your muscle tissue. You induce insulin resistance, which is really the cause of type 2 diabetes. And the best way to keep sugar down is to eat whole foods, but not to overeat, and to be physically active. And one of the keys we found in the Marshall Islands doing research there was to get people moving after they eat. So don't eat a big meal and sit back in your chair and watch TV. Get moving. Even if it's a slow walk, move your body, and that will help also to reverse insulin resistance.
Yeah, I'm sorry, I had to leave for a second. Actually, I'm not that familiar with the clinical information on diabetes and sugar, I should say, but I just pulled up here the data that we had from China. As you know, that was largely a society that had very minimal intake of animal foods, quite frankly. It's remarkably consistent, among 130 different villages, almost identical, that the glucose level, for example, plasma glucose was 60 plus or minus 2 or 3. I mean, and then that's one comment I'd like to make. The other is, without getting into the clinical details of that information, I find it pretty exciting, remarkable that when we put people on these kind of diets, such as these so-called jumpstart programs and the like, the diabetes is one of the first to, get well, if you will, along with reversing heart disease and a whole lot of other things. So it's hard to imagine that somehow diabetes is a different responder to this kind of diet, for example, than it is for the other diseases.
We see it every day, Colin.
This I was just looking at these numbers and I hadn't paid that much attention to them, but it's so consistent across all these male and female.
Right.
Almost right on point. And the other thing I might add too, you've probably seen this, when we get students from China, when they come here, they're in pretty good shape, but so many of them suffer from diabetes before too long. And I think it's the response to that is pretty remarkable. Some of us have seen that for years.